see if they can equalize. United elsewhere would have to hold on to the advantage and see if they can see this out against Fulham. It will be big 3 points for Michael Carrick, and it will be 3 wins out of 3 games for Michael Carrick. If Carrick wins today, he would equal Ruben Amorim's longest winning run in his 47-game tenure. The last time Ruben Amorim did so was in October 2025.
He has won.
Yeah. He's won, eh?
So now that would mean cumulatively some 4 games together for Manchester United. So next week, hopefully, the United fan will now take off his hair.
Oh no!
No, next week. Yeah, he says 5 continuous wins in all competitions.
But this is 3 in all competitions.
So this will be 4. You add the reign of what's his name? Fletcher. Did Fletcher lose?
Fletcher. Okay, Fletcher didn't lose.
Yeah, so 4 wins.
But he's in a row. He said in a row.
But Fletcher left.
But United didn't win. Fletcher, there was a draw.
It was 2-2.
Yeah, there was a draw.
Also 1.
Your story is our purpose. Your voice is our focus. From the streets to the corridors of power, we tell Ghana's story with honesty and courage. Channel 1 TV, telling your story, empowering change.
Myself and the street doctor, Dr. Suarez, have brought a resource person to come and help us with the discussion. The person of someone I describe as my sister, Dr. Apia.
Pia.
All right, no. But Apia,
yes,
he's our street doctor.
The best.
He says everything I say.
Tell me everything you hear on the street.
Sure, I'll tell you.
Yes,
Let's
because I don't roam on it a lot, so
I'll let you
know.
know. That's why I'm there. I'm your eyes on the street.
Sure.
So today we'll talk about infertility.
Sure.
It will not end there anyway. We are going to discuss issues of pregnancy. So after talking about infertility, if by the grace of God you end up getting pregnant, what are the do's and don'ts of
the merit and demerit?
The merits of pregnancy. Suarez,
thank you very much.
What's up?
Really understand.
Issues of infertility. Do you know any family or somebody who has battered?
Oh, a lot.
That's what we read.
Maybe my
5 million.
Oh,
that will be
5 million.
Yes, 4 point something.
1.3.
Can I go to blessing? Bless you. Bless you. One of those.
But I mean, in confusion, I'm fighting infertility.
Infertility, yeah.
When starting kind.
Baby.
I come back as old, but I was yeah, infertility there. I mean, from
no, start with definition for infertility.
Infertility is when you are unable to be fertile, to give birth or something like that.
Okay.
Infertility is the opposite of fertility. To be fertile, if you are able to conceive and give birth, you are fertile.
Dr. Apia, you define infertility for us in your own terms, not necessarily a very technical.
And
the other kind is street definition, or my NTA professional definition.
Okay.
Now,
so infertility, or when we talk about infertility, we are talking about a couple's inability to have any conceive. They are not able to conceive.
It's a wrong.
And not necessarily say when they conceive, they have to have the baby first. But at least
doctor,
I was so a year pregnancy test. Now I say I'm positive.
That's what say. Infertility doesn't start with couple.
It starts with
a human being.
human being, you can't popular.
It takes 2 to get pregnant.
Okay, you're defining it.
Sometimes take 3.
Fair enough. One guy couple. What's a couple?
Ebu anomanya couple. One night stand.
At that point.
And say English couple.
I mean,
couple are interested married.
And to me repeal
at that time, couple. No, couple you brofu, couple you 2.
Yes, and I'm making to me in part 5 you could repeal.
No, so when you say nipa mienu and pregnancy ba oba ni be ma let me clarify because you say me ba.
The good guy.
If you say oba any obema, it is say one night stand cry oba ni obema for this instance no way a couple.
I don't.
So okay,
definition
inability of
the inability to receive or conceive. That's all.
Hey, what definition where there?
Because all the two a reference a fertile land. Because as to be a fertile, all the seeds it may germinate, it may grow. Into we nipa or bar now on a fertile. It will be too much and germinate.
Now then the show say at the end of the show on because some people have seed in it and they're good.
But good because not everybody that gets pregnant had sex.
Hey,
do you doctors agree?
Well, in terms of sex, yes, but say you what? Say any technology about to me.
So how do you define infertility with couple?
Oh, say in this case, no. Oba didn't egg, but not be mad in the sperm, but near your bone.
That's what can be.
Yes, baby.
We told that definition of infertility. No, in the clinical terms, you can say a couple is infertile. In this case, no, Barney or Bema. You can say they've been staying together. They've been having regular sex. Regular sex, you know, it's more than 3 times in a week. Now, it's unprotected. So, you use condom, you use anything that would cause a barrier. Now, after 12 months of that kind of act, you know, still a bambai, then call it infertility.
That definition is being
the
popular definition is that there's a couple, a man and a woman. They have vaginal sex. So there's penis involved, there's vagina involved. They have regular intercourse. By regular, the definition is at least 3 times a week. And they have done this for like 1 year, and there was still no pregnancy. So you see that it's not just a matter of I went to have sex like 2 times and I didn't get pregnant, or I've had sex 1, 2. No, there are some metrics that you need to satisfy in order for you to consider yourself infertile. Remember, 1, there should be a man and a woman. 2, there should be what? Penis. Vaginal.
And vagina.
Coming together. 3, there should be regular. 4, it should have lasted for at least
a year.
If you are 35 years and above, they may say 6 months.
6 months, yes.
But if you are younger than 35, so for us to make a definition for somebody being infertile, in this case, these are the things that we want you to satisfy. And then we can say that.
So are we saying that one person cannot be termed as infertile?
No. It takes 2 to come.
So 2 people have to be fertile.
No, that's not what we're saying.
What is the opposite of infertile?
Fertile.
So 2 people are fertile.
I don't understand.
Okay, 2 fertile people coming together.
So can one person be fertile or not?
Hey.
Okay,
we say no.
On the streets, a Obama is supposed to have the title of potent.
Potency.
Potent. And Obama fertile.
Okay.
And see, if there's anything called infertility in a marriage or in any relationship, it's for the woman. Potency is for the man.
Oh, okay. I understand where he's coming from.
No, I don't understand this, but you let me give him the benefit.
No,
women understand us
infertility. On only explanation is a man is potent, yes. And the woman is
issues of infertility.
That has to be fertile. It is like you're defining infertility and not just only the woman.
Yes, and the man will be impotent.
Okay.
But impotent,
But
those are the definition.
Those are just semantics. It's just the use of
That's what I know.
No problem.
But so give the the clinical one again, the definition again that you are giving. Give it to us.
You know what I admire about you and the street is that you try to bring things into perspective for some of us who have not had the privilege of listening to the street talk a lot. So I admire that. One thing I also want you to admire from us is that we are trying to shape that definition.
That's what I'm saying. Repeat the clinical one.
But I have said it. And you can repeat. I know you can repeat it. Let's go.
So,
Let's go.
Repeat. Okay, what do you remember? What do you remember? You tell us what you remember.
The whole show.
So now when you go to the streets, okay, so when they are talking about infertility and they are saying that it's only the woman, you tell them that no, it's a couple. So a man and a woman who are having regular
sex.
Unprotected. It also has to be vaginal
and penicial.
And they've been doing that more than 3 times a week.
Okay.
And for the past 12 months or 1 year, they've not been able to conceive. But then the definition also changed for women above 35.
Okay.
Because we don't want to miss a whole year. If a woman is 35 years and you want to wait till a year when she's 36 before, maybe she has a problem you're trying, or the couple has a problem, you're trying to find a problem, then you are wasting time for the woman. Because at 35 years, you are considered elderly. A little bit elderly.
So that's the age cap for women.
Yes, so 6 months.
How about men?
For men really don't have the
So you see why we think that fertility is for women.
Well, what you are saying is think, but let's talk about facts here. Now the fact is that causes of pregnancy, 3 things. It could be from the man, it could be from the woman, it could be from both of them, or we don't know the cause. In medicine, if we don't know the cause of something, we call it idiopathic.
Idiopathic.
So, technically,
in medical terms, if we don't know the cause, it's called idiopathy. Or
idiopathic, yeah. So, Dr. Pierre, we know this.
Yeah.
That if a couple comes and then they are described as infertile, it is not just the man. And it is not just the woman, classically.
Yeah.
So we have to investigate and make sure that the man is fine, the woman is fine, or otherwise.
Yeah.
You understand?
Yeah, I get what you're saying.
So we have a lot of women rather coming in the clinic talking about they've not been able to get pregnant when they got married and all that. So we advise that they have to come with their husbands. Sometimes the husbands don't come, which is a bad thing because sometimes it can be from the other partner.
That's intriguing if you ask me, because in the investigation of infertility, it actually starts with the man.
Yeah.
You don't just go. Hardly would you just go and start with the woman and investigate the causes. You start with the man because the man, it is basically just one test you want to do, and be sure that this person.
What test?
But for the woman, it's a lot of tests you will do. So why don't you start with this basic? Just get the man, do one basic test, and the name of the test is called a semen analysis.
Semen analysis.
Yes.
But you see, the men do not want to subject themselves to this kind of thing because it will cost him.
To cost him what?
Yes, money to do the test.
But it will not cost the woman money to.
Listen to me. I'm married to you. I'm chopping you. You are not getting pregnant. You want me to go and pay and do a test when I can cut a Nira and chop her and give you evidence.
But what shows?
So if I chop her to
so when you chop her to an extent and the pregnancy is not coming, that's when you give yourself.
Yeah.
But why
is it cheaper?
It's cheaper
because they will demand. A lot of them demand a lot of things, which I'm sure the test. If you go ahead and just do the test once,
Indomie.
Oh no, but I think that is not a right way to go.
See, if you go to the Bible, look at the oldest couple that we have in the Bible. That's Abraham and Sarah. What happened? Abraham they knew that they were having a problem.
But it wasn't Abraham who decided to go. It was the woman who pushed it.
She loved her husband.
But in this case, it's different.
Are you in any way defending the fact that men should not follow their wives to the hospital?
Yes.
That's a defense.
Yes.
that they should not go.
They should test it. It's called litmus test.
You see the problems that came after Sarah allowed Abraham to go.
Jealousy.
At the end of the yes, so would you want the family to go through all that?
No, I want to prove to you that it's not my fault.
It's a proof.
So don't go to your doctor and come back and tell me that doctor said we should come together. No.
You see, we also have to understand that in the cases of infertility, it's very emotional. Yes, so you wouldn't want to do anything that would cause the woman to stress more. Yes, so I think being a supportive husband is very necessary for the woman as well, because stress in itself can even cause.
I agree with you perfectly here. But I mean, apart from that, the man should know that he could even be the cause.
Yes.
Because the science is telling us that it is either you or the woman.
Yeah.
It's not necessarily just. So if there is an issue, it's only right that you follow your wife to the hospital and allow the doctors to work.
Yes.
That takes us to the causes of infertility. So we're going to take it one after the other. For a man, what can make you infertile? For a woman, what can make you infertile?
Okay.
What do you have to say about this?
For a man, we have about 4.
About 4
Apart
things.
from curses.
Cases.
Yes. They curse you. Your ex.
So there's spirituality and now say.
Yeah. If you go and misbehave with some girl and you leave you go and marry, that's your last.
Hey, I will say yes, steady, because.
But aside that, what we know physical is heat.
Heat, yeah.
If you wear cotton box supporter, and they be a pampers and it's a benwa or bosom.
Hey.
So you see, instead of it being raw egg, I done it because you animal.
Because you animal.
Yes. And men's yes.
No, the fun is actually in the fact that there is an item of truth.
Yes.
Every time I say anything, it's true.
There's small truth.
And excessive use of drugs.
Okay.
Both for sexual enhancement and even the ones that take to work and all that. If it's too much, it can reduce the sperms.
Okay.
Good. Wow. And then one bit I forgot about, you can continue.
But I mean, Dr. Bia, I think there is some item of truth, especially with the heat.
So with the heat, that's why God has made everything hang loose. There's a reason for it. So the testis is inside the balls. Yes. And it's hanging outside because air has to pass around it so that the viability of the sperms are there. So if you're the type that is always wearing something tight, that will force the balls close to your skin. And sometimes when you touch your skin, you can realize that the temperature is quite different from what is around. So then you are rather causing more harm to the sperms than you think. So we are rather advised, even if you want to wear underwear, it has to be cotton, it has to be loose, so that the balls can hang. There's a reason why it's hanging. So let's not change the anatomy.
There's somebody who has children in all 7 or 6 continents.
Hey.
He doesn't wear supporter. I could the radio, I could the TV.
Hey.
I'll follow him. I will now follow him. Now I understand.
Yes, it's in what be hanging. So they are very strong. Nice. It's not just a coin and
Let me just add some few numbers to this. The body temperature is what?
What's
the normal body temperature? 37. If head size, only starting with
the body temperature.
Okay, no problem.
Oh, it's very necessary.
So around 37.
So being a fever, where than one who said.
Say no where she are. Nobody can also when you fever. Remember to 37, 30. Let's all try 37 and when you fever.
We have to.
I've just been talking about the average.
Yes.
So that's around 37. But for optimum sperm production, we are looking at a temperature of about 34, 35. So God in his own wisdom, knowing very well that this sperm production is not too optimum in a very high temperature, he has separated it from the body. Have you seen balls before?
Football at the same.
Who be the say na mama shape. Who be that? Who be the say na mama shape.
Remember the was about 4 na ba.
So you notice that when the temperature goes very high, it will bring it out. So when the temperature when the temperature gets so cold, when the temperature gets so cold that it's dropping, the body says that no, this one is still not helping sperm production. So to bring it closer to the body so that I can get some heat. Do you understand? So that's one cause of infertility.
Okay.
The issues of smoking, alcohol, drugs is somewhat true, but it's an investigation. I don't know if you've seen anything contrary.
Well, some of the drugs that people take can somehow like influence the sperm production. Yeah, so and even erection and things that go on, the hypertensions and the diabetes that goes on, they all affect these things. So yeah.
You want to add something to the causes in a man?
So some men, they tend to work so much with fire. So men that work around fire, the environment, even though it's hanging loose, the environment is not conducive for it.
It's all heat.
It's all heat. Men who sit for a very long time. So men who drive, the long distance drivers. So they are sitting at one place for a very long time.
And those who put laptops.
Yes. And that's the new thing coming up. We have to be very careful because now laptops are around everywhere you go. You see people.
So he's around.
The laptop is always on their lap trying to get some work done. So we advise that you rather put it on a surface or something off.
The thing is called lap. Put it on your lap.
Okay, so then maybe don't bring it close to your balls.
So any lap be the
book top.
And the fatu.
Yeah, but
men farm too close, but heat, it won't help. Yeah, heat,
But people are saying we should have regular sex, but sometimes you have the regular sex, maybe your third one, nothing will come.
Oh, it doesn't take
no sperm.
Yes.
Well, it doesn't take so much ejaculations to to get you pregnant. At least even the one time act. So if enough the sperms are strong and then it comes out once, that can even get a woman
what pregnant. Comes out is not sperms, it's semen.
The semen.
Okay. And in the semen are sperms. And then there are some fluids that is nourishing the sperm. I'm just taking us to the numbers again. So there is a specific number of sperms a man is supposed to produce. So you can actually ejaculate like that. But the amount of sperms inside is not enough to even get a woman pregnant. You understand? So there are terms for it. It's something like oligospermia. That means that the number of sperms inside the semen, small. There's something called azoospermia. There's nothing inside. So the first thing that the doctor would want to do is that anyhow you can bring it to us. So I have more experience than that. Bringing us semen. So when it's come, then it will be analyzed because when they analyze it, they're looking at a lot of things. The thing is that the egg is inside the womb. We expect that the sperms will be swimming. There are some sperms that are like this. So they go now, they are swimming back. And there are some too, they are just moving and they are staying at one place like this.
Runabout.
We've all seen it before. If you look at them, I've seen plenty. We've done a lot of semen analysis too. So that the sperms is doing like this. It can never swim to wherever it's supposed to go. So there are a lot of things that men can contribute. That's why I want to stress that issues of infertility is not just the woman.
Okay, we understand. Men, but are you going to assure us that if we come to the hospital, the nurses would get the sperm from us?
Well, production of the sperm is dependent on you. There are some.
Why can't you get the sperm for you?
Yes, I'm coffee.
The thing is that when we give you the container to take home to produce the sperm and come, you have to bring it within some few time.
That's why we need to do it in the hospital. So you move and drop.
So there's some places where
there's some rules.
And they will find a way.
So
because there's some techniques to show you
for men to actually go see doctors with their wives.
And it's a one-time test. So see, if I say you say men are not traditionally one time per hospital. It's open up your test one just say be a problem, then you have to follow up. Otherwise, once.
So that's fine. Yeah. So aside the heat and what else? The drugs.
The drugs, yes. And
what other sitting for too long?
Too long. Yeah. Stress can also be as for everybody. Stress has a lot of side effects for the body. So if a man is under stress and all that.
So if a couple is infertile, are they able to come out of it to become fertile?
Mm-hmm. Once we know the cause, we can address the cause. Understand? For some people, even in men, it can be infections. Sexually transmitted infections.
Yes. Oh, I even forgot to mention this. There's a condition that affects the balls, like the vessels around the balls. So the varicose veins. So those ones are sometimes they are corrected surgically. You see a man's balls, and then it feels like there's this bag of worm. That's what we call it. I say. Worms.
I think those watching us, they can appreciate.
There's a lot of worms in it when you touch it. I say gogomi,
Those can there are some that there are like veins on the ball.
And so when those ones get
engorged, they can become a lot. Okay. And that can also lead to infection. That can also. So that one is yes. Okay. Most of the time is corrected surgically. See, what they do is that they block some of the vessels so that it reduces the number of vessels.
If you hold the balls like that, one say, as a public one,
why balls not hold it?
I if I hold my balls, there are two. They be me there one. Wait,
there was a big one. Also go for body.
Well, maybe he's talking about those who get the torsion.
I don't know what I say. If you go and hold people's balls, use a bit more there. What happens? No, some men American. Maybe I may examination.
No, say be on investigations. Investigations. On streets.
One of them.
But yes, there are some people are more one where what we call the undescended testes.
Say that again.
Undescended testes
have not undescended. It is shame.
It's still a shame. Testes,
undescended testes.
That kind of testis, it can easily die. Just like how we explained, say the testis is not supposed to be close to the body. It says still a share. Depending inside that, it ends up being a non-functional. And even can go ahead and become cancerous. So maybe I'll use the opportunity to tell women say oh by we bema for because I told them we can salvage the whole situation if viable, like we can pull it back down. Yeah.
And if say when you straight, almost spam near Papa Chain.
Oh, and that's what you're telling.
From what we have discussed now, we haven't discussed now. And it's not.
We never talk about the show.
Because when you sit down for long, because heat. When so
produce sperm.
Let me snap back when it is so. Produce
you produce sperms now. They say, see, sperms they will swim. Yes. It's only a chair corner or book on a beer.
And still after another swimming.
And the chair mui.
A chair.
Now,
perception is a chrome.
And say, boss, no back, also chair back.
Yeah, one can.
I know the structure.
And what you said, it could be possible. There's a cyst. It's fine, can be around it, but which is okay.
Yeah, it's okay.
Yeah. Dr. Pierre, we could also zoom into why a woman may be infertile.
Yes.
Abortion.
Or tire abortion. It made it in a womb. On Ubio.
You know, Dr. Pierre, maybe I may have to say something little about that. Because the issue of abortion and infertility, we shouldn't really use it to scare a lot of people. It is true. It could cause it, especially with the MVAs.
Yes, the one that they use the QX.
MVA.
Manual vacuum aspiration.
Yeah.
Also, abortion bi wɔ ha yɛ de bibi ɛhyɛ nipa ɔbaa n'ase ne atwe mogya ne free ɛna bi wɔn nso ɛma wɔn aduro normal deɛ normally yɛn na yɛtwitwi obi some uterine scars wɔn sɛ ebi a deɛ ɔyɛ no wɔatwe mogya ne nyinaa free ma wie o but still na ebi a deɛ ɔsi bi those ones no but with in an experienced hand you may limit that circumstances nti ɛyɛ na ɛyɛ nkɔfoɔ ya because as soon as somebody becomes infertile then there's a perception say abortion and that I have had a few in the consulting room before where I mean after all the investigations we noticed that this woman is infertile at this point
and
all of a sudden they are thinking that no, there are other things.
No, but even say abortion is sometimes it's not the woman's fault. Say or share that abortion. You know, say you can have a miscarriage.
Miscarriage.
Yeah, but miscarriage is not abortion, is it?
It's a type of abortion.
It's a type of it. You have to say one share down anko yeah. Say one I will cause say we should terminate for you.
You call it
miscarriage.
Until one miscarriage.
I compare Drew and I call doctor.
Okay.
No, okay. Well, the broad topic is abortion. Okay. Street for no. Well, ebi wa ha okọ e say yenye ebi akem ti ye try say ye be evacuate. You know, ye free bibi iatrogenic. Na just say we cause the problem. Ti ebi wa ha se bi o no. You can scrape and then mistakenly scrape some of the normal cells na ewo uterine. Ti say the bibi atwa na ewu na akose scar. Nti to de bia cause scar na it we make sa deformity no in the uterus na a cause sa problem no.
Okay. So you are right. Yeah. Abortion could.
Yes. Yeah. Some people too do not have womb.
Yes.
That is correct.
Yes. And so there are women that are woman they don't have a womb.
And the popular fibroid, but see another yet again the chances of you becoming infertile from fibroid is very slim.
Low.
But it's so easy for people to attribute infertility to fibroid.
Yes.
And people get scared. I have had numerous calls. Scanner. You see,
or fibroid.
And some have broken down.
Yes. Because
but do you know that if you take 100 black women, about 80 of them may even have fibroid?
And they never knew.
And
they've given birth.
There is no need for you to go around scanning people who are fibroid and non-fibroid. It is a journey to nowhere.
Yeah, but the issue of fibroid is when the thing is big and it's covering the womb. That's why you can't.
Exactly. But the question is that how many of them are that big to cover the whole womb? So I admit,
yes,
there are some fibroids. Normally the submucosal ones. There are types of fibroids. Some are pedunculated, some are submucosal, some are other things.
Okay.
There are some that I admit they can cover the uterine lining.
Yes.
But those ones are not a lot.
It's very rare.
And I want to disabuse the minds of people who think that as soon as you have fibroid, you are going to be infertile. Because some people have been scared because of some small abdominal pain. The doctor made them go and do
scan.
And they have forgotten everything that the scan person may have said and remembers just the fibroid because they are of the view that it may lead to infertility, which is totally ridiculous.
Yes.
Okay. So fibroid, I agree, it can cause infertility in some cases. But the fact that you have fibroid, it doesn't mean that you are going to be infertile. Okay. Again, blacks, especially black women, about 80%, 70% of them do have fibroid. So having fibroid is not a big deal.
Oh, we've had women who have fibroids and they have 5 children, 7 children, and all that, and it's not worrying them anyway.
Whether the fibroid is causing a lot of pain, and whether you are bleeding
too much. Sometimes too, it distorts the shape of the uterus.
Okay.
See, when the distortion comes, then it makes it difficult for in case the person will have to have a child that it will take up the space and see the baby cannot grow very well. So that's when we would decide to intervene. Otherwise, the normal thing is not to go and operate on a fibroid.
Well, how about age?
The age of the woman.
Age too can cause.
Yes, the infertility. So, every woman at every month will menstruate. And when you do so, you reduce the number of eggs that you have. At every ovulation, every time that you're about to menstruate, you have about 25 to 30 eggs maturing to try and be the one to be the candidate to be fertilized. And see, after that menstrual period, if let's say it wasn't fertilized, all that 25 or 30 is gone. So at puberty, we have about, for a woman at puberty, around that area, you have about 500,000 of eggs that are available. So every month you are losing about 25. You are losing about 25, and you decide to start your childbirth around 40. What do you think is happening?
You have less.
The eggs are reducing, and even the healthier ones are being lost.
As you grow, it becomes unhealthy.
No, so it becomes weak. As you are growing, things are getting weaker. Your body is becoming weak and all that. And then there are other, genetic things going on. So that's why even women that give birth very late, they tend to have babies that have syndromic and very unhealthy.
The books are telling us that fertility declines sharply after the age of 35 and even more after the age of 40.
So that's why in our definition, we don't want to wait for the woman.
If you are 35 years and you are 6 months and you've not, you don't want to say that, hey, let's give you time. Let's investigate why.
Yeah.
You understand? Because and this is not to scare anybody though, that especially somebody who's 35 and not giving birth and all that. No. Take your time and make your own reasonable decisions. We are just speaking from the perspective of
but it's an advice.
Yes.
Give to them that if you don't get married before 35 or at 35,
yes, your chances of fertility sharply
so
reduces.
Even if you don't want to marry, give birth if you want children. Healthy children.
Healthy children.
By 35.
Like 35.
You have to get them.
Should have.
And then by 40, dear, not just say,
what stop.
But miraculously, some people have given birth at 50 years.
That's also
the chance of having, you can always get pregnant.
Yeah, but what I mean is that children are even healthy.
Yes.
So
it's not even a miracle. It happens. But the thing is that we are talking about
chances.
Probability.
Yes, there's the chances that we are talking about here.
Now, how about different types of men that you've slept with before?
So STI, sexually transmitted diseases.
Not that. Shifting of the womb.
Shifting of the womb. How did the womb shift?
Yeah.
The womb is where it is, so it can't shift.
Sister.
No, explain it. How are they talking about it on the street?
See that? The fallopian tube is like this.
The one you've seen. Is it the natural one you see or the one you've seen in the book?
The one I need to have seen is like this. See your wall.
So you see that. So what do you video?
And you say people are doing it. People can have sex and the woman will start bleeding. And I said, so when this one goes like you cannot produce.
No, it's not true. So maybe the problem here is having multiple sexual partners and then being exposed to some sexually transmitted diseases. Okay. So what will happen is that sometimes it affects the tubes of the woman. And then when it's healing, there's inflammation going on. Because inflammation, say, red in it also happens in the tubes. It can even happen in the wound. Okay. You see, when it's healing and it forms the scar, okay, just like how we were talking about abortion, it can equally come together and then it will cause a block. See, so what's your picture that a woman is an ISN? What say their friend ovaries, a diligent and chain. So a diligent and chain. It's in some ISN, over the ovaries, and one and chain. See, ovaries net took us, I was a faster in Sunny. Net back towards the uterus. It's me kata. It's a kata, but I don't know. And yes, I actually. It's sometimes because of infections.
What kind of it's vagina thing about.
So you're having multiple sex at night?
Yes, because of you see your vagina becomes confused.
Hey.
Because sometimes this is coming. The pent up people. Other times too, you get something like this. Way in Tini. Then you get this one. Before you can get this. So it
get confused.
You can faster now. To me,
when you take the structure of the female reproductive system, so there are some ligaments a money hanging. Unless, of course, there are ligaments now weaker.
It's not. So sex in itself is not a known cause of infertility. Okay. You cannot have sex with somebody to cause infertility.
But do you know an animal called lion? What the battery? The animal eating that animal. That's right.
Debbie.
Okay.
Where
it's also stress. The issue of smoking and alcohol.
Yes, smoking.
Somehow, it's also noted that those things can also contribute. So it baffles me to think that people think these things are flex. When medically it causes a lot of issues. So even smoking and alcohol. The literature tells us that no amount of alcohol is
safe. Yes.
No amount.
And even when you are somebody who takes alcohol a lot, there are a lot of people who take alcohol, they get drunk and all.
When we start talking about pregnancy, you will notice that if you drink alcohol, it can draw on the face of the baby when you will discover.
I've seen people like that.
Okay, fetal alcohol syndrome.
Yes.
Yeah. So Dr. Pierre, as we are talking about this whole infertility, maybe we should give the women some red flags to look at. What are some of the things that when you see you want to go and then investigate? One, pain during sex. It could mean that you may have a PID, pelvic inflammatory disease, like there's an infection. I'm trying to not use too many medical jargon.
Oh, yeah, good. People are learning. Some that student doctors who are also watching.
Okay, so there are conditions called pelvic inflammatory disease. They are normally as a result of an ascending infection.
Good.
STIs. Good. Sexually transmitted infections that move through the pelvis.
The pelvis through the tubes.
The tubes and cause infections. And those ones, when you start having them, you can have painful sex actually. Yeah. Even issues of endometriosis.
Painful menstruation.
Yes, painful menstruation. For some women their menses are unbearable. Their prostaglandins are overreacting.
Let me use that opportunity to tell the public. So when a woman has their menses and then is so disabling, we would have to try and then take them to the hospital. I had a girl like that who has ignored it for a while now. Later on, we realized that it was actually this endometriosis. But you know how our people will say, if you are your bar do some time now, will say pain. But some of them are too abnormal. So I think if you see or you have somebody who is going through that, they should just have the opportunity to check, because then sometimes when you find it early, you are able to help them out so that the outcome is good. Yes.
Let's talk about the management options. So we've established that this couple cannot give birth.
No, sorry, I'm not cutting you. But is that all for the red flags?
Yes, those are the main ones.
So we are the making sure that you don't have multiple sexual partners, and the stress, then giving birth early.
Obesity. Trying to control your weight,
and then the irregularity of your menses.
Yes, you have to.
Those are the causes. Yeah. So once you are having a lot of irregular menses, you should seek help from a medical professional.
But I really like women. When women notice, a lot of women, when they notice that their menses are not regular, even sometimes when they miss, they know that my menses is 7 days. This time around it came out 5 days. They're already in the hospital. So women seeking health seeking behaviors in women, I think it's good, and it should be encouraged. But you have to come in, and then we will diagnose you early and then help you out. Okay. Yeah, our advice.
So then go.
I'm asking of some of the management options. Here is a couple who, for the past 3 years, have been trying to get pregnant. And there's no signs of pregnancy, no conception. What are some of the things we can do to help the couple?
So, first of all, when they come in, as we said, we'll test the man first and then also investigate the woman. And when we find, it depends on what the cause is. So when we find the cause, we would go ahead and then treat. And then some of them are just something small that you would have to do, a little surgery or some medications, and then they are all corrected. So people should come in. They should come in. They shouldn't wait, because I've seen people who wait till 15 years.
Some of them, they are just not having sex. Let me tell you one thing that has worked for some of my patients. The definition of regular sex.
Yeah, okay.
For me, when you come, I will make you have sex with your partner every other day until the month ends.
To see.
80% of the time, they achieve pregnancy. So, today, pine. Tomorrow, rest. The following day, pine. The next day, you rest. Pine, rest.
That's one pair, one.
You know why? No, this is a case where we are going aggressive. We want you to achieve pregnancy.
So one
round. The hearing said every other day you are having sex. You understand?
When it becomes like that, I've told you that I said Tokwa.
But a lot of people.
I hope the sweetness and happiness.
Of course, it has to come with pleasure.
I agree. Yeah. But in this case, just for 1 month, we are looking for a baby.
Yes,
it is a baby. The baby crocodile so every other day.
Or call with or that them soon.
So you cannot have sex every other day. I'm not talking about the leg though.
When sex is too much like that.
No, Sabika, I think I spoke about that earlier on. Even if you achieve one ejaculation.
You can have
it's
one
okay.
ejaculation,
and then you're okay too.
Yes, for me, I'm not saying that it works for all doctors, but for me, the few I have seen and the progress report I have had.
Yeah.
I'll tell you one story off camera.
So that what Dr. Hassan is saying is very true.
Bruises.
Oh wait, that might be a bruise way.
But that's a men are always ready to go.
Some men can have sex every day.
Ready to go.
Maybe with different women, fair enough. But they can have
over. If the lubrication is good, a problem you.
I'm not married.
But yeah, I agree with Dr. Hassan. So we'll have to fish all those things. And then there's also the women that's after sex.
If you are in the health space,
yes,
you hear a lot of ridiculous things.
You hear
I have some people who tell me things on the blind side of their significant other.
That's fine. I'm interested in the raising.
Yes, some people raise their legs. That if they raise their legs, that's when the sperm will
go inside. Doggy style.
The spells do not matter.
It doesn't matter. All that matters is the sperm is able to move.
There's something called the litotomy position. Have you heard of it before?
Litotomy, yes.
What is it?
Totonia.
All those positions do not really matter.
The position doesn't matter. It has to be the sperm. Yes, the sperm has to be healthy to move. And who here said we will raise your legs to the skies? If the sperm is not good, accorded that.
So that's what I'm saying. We don't have to get these kind of examples because on personal it's not about infertility. Okay. So are you saying that this one is on the side though? If or on him?
I just said it on the flip side. Say we will have the send the bear space be cool. Send the bear Benjamin, it be quite and won't change anything. And we will also or send the bear on him, but with me.
Sperm, so we are smart. God call it that.
Once upon a time, you were the fastest sperm.
I know. And I'm still the fastest shooter of new sperms.
Ladies and gentlemen, sign us out.
If you have any other contribution or question, you just go on the comment section and then put it there. We doctors will be there to.
You will be there to.
You are Brosco told mine.
You are a good doctor.
So we'll be there to answer all your questions and then debunk certain myths and all that. So thank you so much for coming, and we'll call on you again because we haven't finished. You have to teach us the sex position and styles that can get for pregnant women to continue having sex when they are pregnant.
All the questions are. I'm here to answer them.
It up. Yes. So it's been another wonderful session on Health Quarters Ghana with the great Dr. Hassan and the Dr. Apia and the Dr. Clemento Suarez. And we are coming to you once again from the studios of Core Media Studios. And where can we be located? Westland 65 Boulevard. So please keep it locked, keep it down, clock it.
What's up?
Kulo.
What's your name?
Gafaro.
Gafaro. That's a nice name. What's your name?
Gabriel.
Gabriel.
Yes.
You dey go in this school?
Yes.
It is so. Charlie, what course you dey study?
Visual arts.
Visual arts.
Yes.
Okay, that be hard. Mention 4 animals that can be found at Moli National Park.
Kangaroo.
What?
Kangaroo.
Okay, that's one.
Elephant.
Okay, that's true. Your man they think. It's actually they think. Wow, don't be smart thinking. You hold on. I'll come back to you. Mention 4 animals that can be found at Moli National Park.
Elephant.
Yes, that's correct.
Monkey.
Clap for her.
And
And what?
bears.
Okay.
Okay, and what?
I don't forget.
No problem.
What is the name of the overlord of the Goja kingdom?
That's my guy. I don't know.
So we can ask you, what is the name of the overlord of the Goja kingdom?
Yeah. Young Bora. Bikunuto. Solid.
Okay.
Recite the national pledge.
The national pledge. Yeah. God bless our homeland.
Okay.
Ghana.
That's right.
And make our nation great and strong.
One time.
Good to defend forever.
Okay.
And help our
Child, there is God. There is God.
Yeah, that.
Bring our hearts reach through humility.
This guy. Oh, go ahead, tough, yo. We are tough, yo. See that one. Recite the national pledge.
I promise on my honor
Yes, that's correct.
to be faithful and loyal to Ghana, my mother.
Okay.
I pledge myself in the service of Ghana with all my
With all.
my strength
Okay.
and with all my heart.
Okay.
I promise to hold in high esteem
Okay.
our hated one for us.
That's right.
Through the blood and tongue of our Father.
Okay.
And I pledge myself all to uphold and defend the good name of Ghana. So help me God.
Charlie, nah, you guys is solid guy, Charlie. What's your name?
Beatrice.
Beat rice.
Yes.
Beat rice.
Yes.
Where's the rice? Beatrice, yes. Mention 4 animals that can be found at Moli National Park.
Elephants.
Okay.
We have monkeys.
And what?
Monkey.
Okay, yeah, monkey.
Yes. We have
What?
lions are there.
Okay.
Goats.
What?
Goats.
Goats.
Yes.
Meh.
Yes.
A punching.
Yes.
Oh, okay, I see goats. Right. Recite the national pledge.
The national pledge.
Yeah.
I promise on my honor
to
be faithful and loyal to Ghana, my motherland.
That's right.
I pledge myself to the service of Ghana with all my strength and with all my heart.
Right.
I promise to hold in high esteem our heritage won for us through the blood and toil of fathers.
What?
Through the blood and toil of our fathers. And I pledge myself with all things to uphold and defend the dignity of Ghana. So help me God.
Charlie, you see, I'm in my town. This is Tabago. You see how them about be away.
He make me proud. He make me proudly.
What is the name of the overlord of the Gonja kingdom?
Yongbeura Bikunuto Josele the first.
Charlie, take that again.
Yongbeura Bikunuto Josele the first.
Hey, what be on?
Zumba, zoom, zumba, zoom, zumba.
Hi.
What's your name?
My name is Elisha.
Elisha, Charlie, you were the command fire from heaven and things.
Yes, I'm the one.
Hey, Kenny.
Yeah, you be the guy.
Yes, sir. Yes, sir.
Elisha.
Yes, sir.
Recite the national pledge.
I should recite the national pledge. Okay. I promise on my honor.
That's right.
To be faithful and loyal to Ghana, my motherland.
Okay.
I pledge myself to the services of Ghana.
And what?
To the service of Ghana.
Okay.
With all my strength and with all my heart.
Okay.
I promise to hold in high esteem our heritage won for us through the blood and toil of our fathers.
My God.
And I pledge myself to all things to uphold the good name of Ghana. So help me God.